We will hear more about David keeping fit tomorrow's programme. Now, for most of us, an appointment with the dentist is not exactly a dream date. But if you're a smoker, a drinker or a caffeine junkie, you're probably even less enthusiastic than the rest of us. But can you ever restore your neglected gnashers to the pristine pearls they once were? Debbie Davis from Southampton is on the line now, looking for answers. And here to help is our very own user-friendly dentist, Dr. Marc Mortiboys. Thank you for coming in, Mark. Now, Debbie, are you there?
Yes, I am.
So what is the problem that you've got at the moment?
Well, I'm a smoker and I've got stains all across my teeth that's really quite noticeable. And behind my teeth as well, at the backs. And it's got to the point now where I'm just so self-conscious. I've started to put my hand over my mouth.
Do people comment?
Well, nobody actually comments, but you can see them looking, and it is quite noticeable. And there's lots and lots of different options I've seen in magazines, different ways of combating it, but I'm just a bit confused about what's on offer and how much it's going to cost, really. And will it hurt?
So, Mark.
Yeah.
Mark, what is available? What can she do to whiten her teeth? And will it hurt?
Exactly.
And is it available on the NHS as well? We ought to
Good
ask.
questions. All very good questions. Hi there, Debbie.
Hello.
I've got a still, actually, a photograph I'd like you just to see for a moment. If we can put that up on screen now, that'd be great. We got it on there? Oh, it's
Go
over
ahead.
here. Right. Well, is that similar to you, Debbie?
Yeah, it is.
Yeah, so very stained filling there. We'd be pleased to know that in that sort of situation, you're really in the simplest category. Very straightforward. All that has to be done, especially if the filling is sound, is only very, very young, maybe 1 or 2 to 3 years old, and maybe just on the surface. So we can just cover and patch up over the surface.
The cigarettes particularly affect the edge of a filling.
That's right.
And we could see in those photos before and after, it was actually the same person.
That's right,
wasn't it?
Incredible. Incredible difference.
So what exactly would you do?
Well, what I would first of all do, and this is for all listeners and viewers, and obviously yourself as well, Debbie, what I'd first of all do is go and just go for some advice. Maybe go to the reception area and ask for someone just to have a little peep and to say, what do you think? And if they feel that you need to see a dentist first, then go and just pop in and ask for advice. Don't get committed to any kind of treatment first of all. And then find out what all the options are. There's also the British Dental Health Foundation, which you can contact. Wonderful organisation, a charity. They'll send brochures and things.
When I say, what are the options, I don't mean going and asking an association, because she's asking us.
Yes, I know.
So I'm going to ask you, what about smokers' toothpaste?
They're the first options. So what I would first of all consider is do something at home. Get some advice first of all. Go to a dentist, and they'll probably initially suggest go and try some of these tooth whitening pastes. The only problem is that they can be overused. They are significantly more abrasive than normal toothpaste.
And they taste absolutely disgusting, don't they?
Some of them do, but I'd be very careful with them and very gentle. And if you feel that you're getting good results, then just use them just infrequently, just normal toothpaste in between. But if you don't feel you're getting that much of a result, then go for more advice from your dentist.
Debbie, have you tried the toothpastes?
No, I haven't, but...
Right.
That might be a... You're going to carry on smoking?
Probably.
That's certainly one point I'd like to comment
Continuing problem.
on. Yes.
What then is available in the dentist? There are veneers and there's other kinds of treatments and so on, isn't there?
Well, what we saw in the still was basically just a surface replacement of the filling. If the filling was actually not so sound, was still coming away from the tooth, or there's maybe even decay in there, then we'd totally remove it, make sure everything's sound underneath, and then refill. And the material is like a glass cement. It's mainly quartz crystal with a bit of plastic resin. Very, very cheap. If you're exempt from the NHS charges, you can have that sort of treatment for free, even privately. And I'd urge a lot of people to maybe consider a private option, because then the dentist can spend as much time as it takes to get the perfect job for yourself. So, and even then it would only cost 30 to 50, maybe £80 at the most for one tooth. Just
for cleaning up that?
That'd be for totally replacing a filling. And
the odds are Debbie's going to have quite a lot of them done, isn't that right?
Yeah, probably.
It's going to cost more than £30.
Yes, but I'd recommend first of all seeing a hygienist or a dentist that cleans the teeth.
Start off by getting them cleaned.
And then maybe we can also buff them up. We have like little sandpaper discs, but very soft ones that just polish rather than cut like we do on the walls. But they just like polishing cups and polishing papers that will take off most of the surface stain. And for a lot of people that will be more than adequate. It depends on how good a quality you want.
Now you can buy bleaching kits, can't you? Would you recommend
Bane of my life a little bit.
Go on, why?
I would say that in the dentist's hands, they're great. But like a lot of things, a lot of these over-the-counter products, what I certainly see is just an abuse of the material. And people are coming in with sore gums, possibly, or sensitive teeth in some cases. Not in all cases. I'd say the majority of people are actually getting great benefits without side effects. So I would certainly advise maybe to have it done, especially constructed and created by the dentist rather than just getting over the counter, so that it can be monitored and the results also staggered, and just go gently with the process, because at the end of the day, teeth are organs. People don't seem to understand that teeth are not just rocks that grow out of our jaws. They're all organs. They're just like a kidney in many, many ways. So just treat them with respect.
In the minute or so that we've got left, I want to get you onto veneers, partly because they're a little more expensive, and we ought to be honest with people. If we're asked for advice, sometimes the best advice is a more expensive option, but also because I had a couple of mine done, I won't say which ones, and I was jolly pleased, not because I'm a smoker, but because my teeth, because of age, were just getting darker, and the veneers both strengthen my teeth and look good, and yes, I did have to save up for them. So what's your view of them?
Well, I think they're absolutely fantastic. I did 7 years ago, did my mother's, all the way across, all three, canine to canine, eye tooth to eye tooth on the front. They're still there after 7 years. The only slight downside maybe that they sometimes could come off, or you have to be very careful when you're drinking out of a glass or a mug.
They're porcelain, aren't they?
They are porcelain. They're just like a bit like a false fingernail, you know, when you just glue on the surface, and they can be done with porcelain, but also now a very strong plastic kind of material, which is probably better now because they don't tend to shatter.
And it's quick and it doesn't hurt?
It's generally you can have it done without an injection. Most of this cosmetic work can be done without injections. It's fairly cost effective, and the amount of self-esteem boost that one can get from this sort of treatment is absolutely phenomenal.
But you're probably talking about £300 or two. So, Debbie, what you're going to have to do, I think, is give up the cigarettes, save the money, and get your teeth done.
Absolutely. Great advice, Edwina.
Oh, there we are. Edwina's at it again. Now, if you would like us to investigate a problem on your behalf, don't forget to ring in our hotline. The number to call is 01703 712 510. That's 01703 712 510. Or you can write to us at Espresso, Television Centre, Southampton,